Hello, my name is Kaitlynn, and today I'm going to be discussing access to mental health care and the role of nursing advocacy. First, I want to start out and just go over mental health is an essential component of overall health, yet many individuals struggle to receive the care they need. In this presentation, I will explore the current challenges surrounding access to mental health services, how these barriers affect healthcare quality and safety, and the financial impact on individuals and society, and how healthcare policies influence access to care. I will also discuss the critical role that nurses play in advocating for improved mental health resources and ensuring patients receive appropriate care. By understanding these issues, healthcare professionals can work towards improving outcomes and promoting equity in mental health treatment. So, to start out, mental health refers to a person's emotional, psychological, and social well-being. It influences how individuals think, feel, and behave, and it also affects how they handle stress, relate to others, and make decisions. Mental health disorders are extremely common. According to the National Alliance of Mental Illness, about 1 in 5 adults in the United States experience mental health each year, and 1 in 7 children between the ages of 6 and 17 also experience a mental health disorder annually. Globally, the World Health Organization reports that nearly 1 in 7 people worldwide are living with a mental disorder. Despite the high prevalence of these conditions, a significant number of individuals do not receive treatment. In fact, research shows that only about 1/3 of people with depression receives formal mental health care. These statistics highlight a major healthcare issue. Although effective treatments for mental illness exist, many individuals face barriers such as cost, lack of providers, stigma, and limited availability of services. Access to mental health is critical because untreated mental health conditions can significantly impact both individuals and communities. For individuals, untreated mental illness can lead to decreased quality of life, impaired relationships, difficulty maintaining employment, and worsening physical health conditions. Mental health disorders are also associated with high rates of chronic disease, such as cardiovascular disease and substance use disorder. Families are also affected when someone struggles with mental illness. Caregivers often experience emotional strain, financial stress, or burnout while trying to support their loved ones. At the community level, limited access to mental health care can contribute to homelessness, unemployment, and increased involvement with the criminal justice system. These consequences demonstrate that mental health is not only a personal health issue, but also a significant public health concern as well. Limited access to mental health care has a major impact on healthcare quality and patient outcomes. When individuals cannot access treatment early, mental health conditions often worsen over time. Delayed diagnosis and treatment may lead to more severe symptoms, increased hospitalizations, and higher use of emergency services. For example, the World Health Organization reports that only 29% of people with psychosis receive treatment, and only about 1/3 of individuals with depression receive formal care. This gap between the need for treatment and the availability of services significantly affects patient outcomes. Poor access to care can also lead to fragmented healthcare when patients receive treatment only during crisis situations instead of through consistent preventative care and early interventions. Improving access to mental health services is therefore essential for improving overall healthcare quality and ensuring patients receive timely, effective treatments. Access to mental health is also closely connected to patients and community safety. For patients, untreated mental illness can increase the risk of severe symptoms, self-harm, or suicide. Mental health conditions such as depression and bipolar disorder are strongly associated with suicidal thoughts and behaviors if left untreated. Healthcare professionals may also experience safety concerns. Nurses and other healthcare workers often encounter patients experiencing psychiatric crises, crises, which can increase stress levels and contribute to workplace burnout. Society as a whole is affected as well. When individuals do not receive appropriate mental health treatment, it can contribute to increased rates of homelessness, incarcerations, and substance misuse. Insurance Ensuring adequate access to mental health can service help. Okay, hang on. I'm so sorry. Ensuring adequate access to mental health care services can help reduce these safety risks and provide individuals with the support they need before crises occur. Financial costs. Limited access to mental health care also has significant financial consequences. For individuals, the cost of mental health services can be a major barrier. Many people face high out-of-pocket expenses for therapy sessions, medications, and specialized treatments. Additionally, individuals with untreated mental illness may experience job loss or decreased productivity. The economic impact extends beyond individuals to society as a whole. In the United States, mental health conditions are estimated to cost the economy over $193 billion each year in lost earnings due to reduced productivity and disability. Healthcare systems also experience increased costs due to repeated hospitalizations, emergency department visits, and long-term treatment needs that could have been prevented with earlier interventions. Expanding access to affordable mental health care could significantly reduce these financial burdens while improving patient outcomes at the same time. Healthcare policies and regulations play an important role in determining access to mental health care. One major policy in the Mental Health Parity and Addictions Equity Act, which requires insurance companies to provide mental health benefits that are comparable to coverage for physical health conditions. This law was intended to reduce discrimination in insurance coverage for mental health services. Programs such as Medicaid and Medicare also provide coverage for many mental health services, including therapy, psychiatric evaluations, and medication management. Advocacy organizations such as Mental Health America continues to work with policymakers to expand access to care. For example, recent legislation such as provisions included in the One Big Beautiful Bill Act help states improve verification systems for Medicaid eligibility and maintain access to behavioral health services. Although these policies have improved access, many challenges still remain. Despite existing policies, access to mental health care remains limited for many populations. One major issue is the shortage of mental health providers, particularly in rural areas. Many communities lack psychiatrists, psychologists, and licensed therapists, which can result in long wait times for appointments. Insurance limitation also affects access to care. Some insurance plans cover only a limited number of therapy sessions or require high copayments. Telehealth has recently expanded opportunities for mental health treatment, especially during and after the COVID-19 pandemic. Virtual therapy and psychiatric services can help reach individuals in undeserved communities. However, telehealth services still depends on reliable internet access, insurance coverage, and technology literacy, which can create additional barriers for some populations. Nurses play a critical role in addressing barriers to mental health care and advocating for patients. One important responsibility for nurse is patient education. Nurses help patients and families understand mental health conditions, treatment options, and available resources. Nurses can help connect patients with community services, including counseling programs, crisis hotlines, and support groups. In addition, nurses participate in interdisciplinary collaborations, working alongside physicians, social workers, and mental health professionals to provide comprehensive care. Beyond the clinical setting, nurses also have a role in policy advocacy. By participating in professional organizations, contacting legislators, and supporting mental health initiatives, nurses can influence healthcare policies that improve access to care for everybody. The contemporary issue that I chose for this presentation is access to mental health care. I selected this topic because mental health care conditions are extremely common, yet many individuals still struggle to receive treatment. The gap between need for care and the availability of services highlights a significant challenge within the healthcare system. Mental health is also closely connected to many other aspects of healthcare, including physical health, social determinants of health, and healthcare equity. As future nurses, understanding these challenges is essential because we will frequently encounter patients experiencing mental health concerns in a variety of healthcare settings. Improving access to mental health services can significantly improve patient outcomes and overall community well-being. Access to mental health care is not only a national issue, but also a global health concern. Globally, research shows that between 76 and 85% of individuals with severe mental illness in low-income countries receive no treatment at all. This highlights the significant disparities in mental health services across different regions of the world. Many factors contribute to these disparities, including poverty, stigma, limited healthcare infrastructures, and shortage of trained mental health professionals. Even within the United States, disparities exist between urban and rural communities. Rural areas often face provider shortages, transportation barriers, and limited healthcare resources. These disparities emphasize the need for policies and healthcare strategies that address social determinants of health and promote equitable access to care. Several strategies can help improve access to mental health care. One important approach is expanding community-based mental health services, which allows patients to receive care within their local communities instead of relying solely on hospital settings. Increasing the use of telehealth services can also help reach patients who live in rural areas or who have difficulty traveling to appointments. Addressing social determinants of health, such as housing instability, poverty, and transportation barriers, is also essential for improving access to care. Additionally, expanding the mental health workforce by training more mental health professionals and supporting peer support programs can help reduce provider shortages as well. Nurses are uniquely positioned to advocate for improved mental health access. In clinical practice, nurses advocate by ensuring that patients receive appropriate referrals and support services. Nurses also prompt early identification and mental health concerns through routine screening, patient education, and supportive communication. At a broader level, nurses can advocate for policy changes that improve healthcare access and reduce stigma surrounding mental illness. By speaking up for vulnerable populations and supporting evidence-based policies, nurses can play an important role in shaping a more equitable healthcare system. So, some key takeaways. In summary, mental health disorders are common and affect millions of individuals worldwide. Despite the availability of effective treatments, many people still face barriers for accessing mental health care due to cost, provider shortages, stigma, and healthcare policies limitations. These barriers impact healthcare quality, patient safety, and economic outcomes for individuals and society. Nurses play an essential role in improving access to care through patient advocacy, education, interdisciplinary collaborations, and involvement in healthcare policy. By addressing these challenges, healthcare professionals can work towards creating a system that supports mental health and promotes overall well-being. Thank you so much for your time, and I hope you have a great rest of your day.